Hey y'all, share my screen here. You all see my screen? All right, all right, we're gonna get started here. So if you want to put in the chat, you say where you join us from, your name, we would appreciate it. Thank you for letting me know that you can see the screen and hear me. I'm Josh Johnson. I'm with the Alliance. I'm with our capacity building team. This is the second part of a series called Leading in the Moment, really focused on how do we best prepare ourselves in these moments of uncertainty, and just improving certain elements of our work to really ensure that we are working to end homelessness for the most vulnerable folks in our community. So if you're not familiar with the Alliance, we lead with our values, which is by inspiring faith that ending homelessness is possible, leading with love, and working to bring our neighbors home. Um, we do this in three different areas. Well, one being really our policies and programming part, and focus on advocacy and navigating the federal policy landscape. We also do this with our HRI, our Homeless Research Institute, providing continued data analysis to really look at what's happening and really establish and understand, lift up trends within the field. Then we do it with our capacity building, which is myself, Rachel, who's not here with us, Marquetta, Deve, and Malik. We uplift best practices and training opportunities for communities to elevate evidence-based strategies to ensure that we're working together to end homelessness. Really quick about us, our goal is to create a space that is brave, a space that allows for free thinking and different differences of thought. With that being said, we have zero tolerance for any discrimination or abusive behavior. Anything that is seen will result in being removed from this call. So as I started off with, this is a four-part series. With the first one, we talked about leading through change, really focusing on governance and coordination, inclusive decision making. And then this one's more focused on integrating partnerships, working across aisles, working with different systems to really ensure that we have all the folks who are in or around the homeless response system working together collectively to reduce harm and bring people home. So again, today's really focused on working across systems, integrating public safety, faith communities, and behavioral health into the work we do. Right, a lot of this is already established in our work in our homeless response systems, but as we continue to build out the table and invite new folks along, we really want to talk about how do we strengthen those partnerships and really work towards a common goal that leads with accountability and collaboration that improves safety for everyone and housing outcomes for the people we serve. One of the things that we talk about when we talk about a system, we talk about how do we ensure that our system is effective. Equitable means it meets everyone's needs and is efficient. Is as working towards a common goal where we divert people when safe and appropriate from experiencing homelessness, and then we house people as quickly as possible and wrap them up with services with the goal of making sure homelessness is rare, brief, and one time. So some of the symptoms are signs that you're working towards this end game is people are not unsheltered. People in a housing crisis have access to immediate help, including safe and places to go. People do not spend long periods of time experiencing homelessness. When people are identified, they're quickly exited to housing services to get them stabilized and ensure that they're not falling back into homelessness because they are provided the necessary support services. And then everyone has equitable access to housing. There is no barriers for certain types of groups, right? We're treating people as people. We're leading with love, and with the goal of bringing folks home. And then when we're making investments, that could be investments in partnerships, investments in interventions and resources, we're doing it in a coordinated way, right? A lot of times when we're operating in a crisis response, we're trying to navigate these moments that are uncertain. We make a lot of really great decisions, but they don't fit well together. So how do we move from a lot of interventions that don't flow to actually interventions that move the needle and allow for in all the interventions that we in the partnerships and interventions that we do invest in actually work coordinatedly and connectively to get people out of homelessness as quickly as possible. And what does this take? We need courageous and bold leadership. We need a local coordinated homeless response system and a homeless. And when I say that, that doesn't mean just folks who get COC or COC ESG funding. That doesn't mean just folks who are on a board or any type of any part of the governance structure. That's all folks working to end and address homelessness. And that could be your smaller churches, your advocacy grassroots organizations, your hospitals, your other systems that touch the same folks. How are we coordinating and how are we working together? This requires strong partnerships, right, that hold each other accountable towards an aligned vision of ending homelessness. So why do we need these partnerships, right? Because a lot of times we serve the same people. And we don't always know it. We don't talk, but we're interacting, engaging with the same folks, and sometimes providing the same resources and services. It's also with the understanding that no single system can solve homelessness alone. Homelessness is a concentration of failed systems, not one, that leads to someone in a housing crisis. So in order to address and adequately move the needle on addressing homelessness, we need those complex systems to coordinate and work together to really adequately address the needs of folks experiencing homelessness. We also need clear roles to reduce confusion and harm, right? If people go to every time they touch a system and they say something totally different, or they tell them to go somewhere else to get resources and services, and that place doesn't offer resources and services, that causes harm. When we ask people to tell their story multiple times, depending on who they talk to, that causes harm. We also know that coordinated action improves safety, right, for all folks. If people could understand when engaging with certain systems leads to actual care and help, it allows for folks to trust into that system to work collectively to actually address their homeless crisis. It also, again, as mentioned, shares accountability, and it strengthens really clear steps for follow through, and it ultimately improves our housing outcomes because we really we improve the services and resources in a coordinated way that actually work towards addressing someone's housing crisis and providing the wraparound supportive services needed to help them stabilize, right? We're not as to that picture with a lot of the cars going different directions. We're not just inventing and using resources in a reactive way. We're actually proactively using resources to ensure that we're all working towards a systemic response to homelessness that leads towards housing and stabilization. Now, I did not want to talk that much on this call, but I'm happy we have a wonderful panel of folks who are going to talk and share their amazing expertise. So I'm going to start by introducing Veronica Lewis, for a partner at the Impact Group, to just chat, to talk, introduce herself and kind of her role in this conversation.
Thanks so much, Josh, and I'm really glad to be here with you all today. Again, Veronica Lewis with Impact Consulting Group and Changemaker Consulting. And I spent the last 20 years in my career trying to really help usher in system transformation. And a lot of that work included being more thoughtful about how we really integrate and meaningfully collaborate across different sectors and fields. And so all of the things we're going to be talking about today, I've either been a part of those collaborations or actually led and created them to have a thoughtful connection to law enforcement, to minimize criminalization of homelessness, and to also help save lives, right? To work within our faith-based communities. I'm a minister's wife as well, and so I have another connection to that community as well, right? To figure out how to uplift the great work they're already doing and also make them a meaningful part of our continuum of care and our network, as well as, lots of deeply integrated programs that encompass homelessness, reentry, substance use disorder support, mental health support. And so looking forward to the conversation today. learning from my fellow panelists and sharing the insights that I have. Thank you, Josh.
Thank you so much, Veronica. I learn something new every time I talk to you. So excited. I'm gonna pass it to Brian.
Hey, good afternoon, everyone. Brian Postlewaite. I live here in Orlando, Florida. Um, I work every day at the lead agency for this Florida's Continuum of Care, which I work as the chief operating officer, and I'm also a volunteer board president of the Florida Coalition in Homelessness, which is our statewide coalition of COCs and other stakeholders working in homelessness in our communities. It's great to be with you. Um, Excited about this conversation. I think my background, I have really similar kind of experiences as the rest of this panel. I dabbled in the faith-based world and faith-based responses to homelessness in the the early to late 90s. Kind of let my appetite on FQ federally qualified healthcare centers and also in the employment space, mental health space, day services, and now from more of a systems perspective at a continuum of care. I really kind of think of myself as a leader, as someone who's trying to architect uh, systems. I say that humbly. I really think that great leaders don't solve every problem. That's kind of an impossible task, but uh, my task is really to help build cultures and communities that are capable of solving problems together. And that's the much more challenging work. And so look forward to being able to talk more about that. Great to be here.
So much, Brian. Next, Kevin.
Good afternoon, everyone. My name is Kevin Nye. I've been working in homelessness and supportive housing for the last 10 years. Started out in Los Angeles and am now in Minneapolis, Minnesota for the last 4 years. That's sort of always been my day job, but separate from that and still related to that. I've written a couple books on how faith communities can get involved in the fight to end homelessness and to do so while maintaining, integrity of their faith values and also embracing what we know to be best practices. My sort of slogan, if you will, has become you can be faith-based and evidence-based. Those don't have to be mutually exclusive. To that end, I also co-founded the National Faith Coalition to End Homelessness. It was a group of us who share this sort of dual identity of folks who have been in homelessness response and have been involved in faith communities and faith organizing. We're trying to galvanize more churches, the churches that are already doing great work. We want to put them in network with one another. And for churches that are new to this work or want to be part of this work, we want to help empower them with resources, with best practices, with mentorship opportunities, with whatever they need to get going. And so I'm really excited about this. I'm really excited that Brian and Veronica are here as well. Demetrios, you're new to me, but I'm excited for you too. But that both Brian and Veronica also have a lot to say about this faith-based world. I think it's going to be a really rich discussion. So thank you all.
I hope you all are seeing that we have a dynamic panel for you all. I just hope you're picking up on that a little bit. But last but not least, Demetrius, you want to introduce yourself?
Sure. My name is Demetrius Mastoris. I'm the Executive Vice President of Safe Night. We're a consulting organization that helps cities, business improvement districts, continuums of care, community service providers with complex problems. We bring unified strategies to cities to deal with complex problems and complex interests for many different people. And my background is I'm a retired police officer from Arlington County, Virginia, where I led a multi-component and multi-agency response to violence. through a prevention model, and using this through a individual relationship-based approach that I'll talk about as we get going here. So I'm happy to be part of this. This is, it takes all of us to do this work, and I'm happy to share maybe some of the perspective for folks who are on both sides of the coin here, on the street and on the policy side. So thank you.
Thank you so much, Demetrius. And Kevin, really quick, can you uplift the group that you founded again? We had a question.
Sure, that's the National Faith Coalition to End Homelessness. I can throw the link in the chat, nfceh.org.
Thank you so much, Kevin. And to that point, if you have questions, please throw them in the Q&A. We'll try to address them sometimes in real time. Sometimes when we'll have some time at the end to have questions. We have some prompts for our esteemed panelists that we'll go through. But we try to make it as informal and interactive as possible. So ask questions, and we'll do our best to answer them as they come up. So you all have so much expertise. My first question is for Veronica, but also for the panel as well. So I think when we talk about navigating different institutions in our developing relationships with different partners, and there's a lot of thinking that we're all kind of working towards different goals, right? So how do we think in terms of more of a collective impact, so we can get the most of those relationships, specifically in moments where some of the resources seem to be shrinking in some areas and also increasing in others, right? So how do we navigate these relationships by working towards a collective impact model?
Yeah, thanks for that question, John. I think that, I loved that you used the term lead with love. And I know that the Alliance for the last several years has introduced the word love into the space that we're in, because ultimately when we're talking about collective impact and cross-sector collaboration, that's what it's about, right? And the love in the context of these social services, health services, homeless services, is really related to ultimately the goal and missions of trying to save people's lives, trying to improve the quality of people's lives, to the extent possible, trying to shift the trajectory of people's lives. And I think that that's what should be at the center of collective impact models, because obviously when we talk about cross-sector collaboration, there's multiple perspectives, right? Even differing service philosophies. But the reason collective impact is so important is because, one, we can't do things in silos, as you said, in particular in these kind of times where policies are creating more barriers for a lot of people we serve, where funding contraction is happening, and you name all the other factors. It's even more important to be able to work across sectors so that we can continue to coordinate, have our mission aligned focus, and make sure that at least we try to prevent the bottom from falling out completely, even if we've lost resources or have to shift the way that we're practicing or doing our work in some ways because of policies. And so I think that, some of the things that, and again, I have led and formed collaboratives with very different perspectives, right? With doctors at the table, right? With folks from law enforcement at the table, people who are approaching the issue or the challenge of trying to address homelessness from very different perspectives. They have different approaches and a different lens by which they're trying to do their part of the work. But one of the reasons that many of the collaboratives that I've been a part of or even started have been successful is because we can always find the common ground. And the common ground is the people who we are here to try to support. And even if we don't necessarily agree on the service philosophies or the best way to support folks, if we can always center the conversation and ultimately trying to save a life, help somebody move the needle on whatever part of their journey they're on, then we can always come to alignment and figure out how we move together as a collective and a collaborative. And the other thing that centering the shared values and the commonality does is when all the egos come to the table, especially when you initially have collaboratives happening with lots of leaders and egos are at the table, it grounds us to remember what this is about. It's about the people that we're trying to serve. And I think that when we do that, I don't think I know, because I've experienced it, I've been a part of it, I've learned, right? I've grown. in these collaborations, we can not only have a collective impact model that allows us to look at all the different variations of how we're doing our work and what our target focus is, and ultimately help improve the lives, help remove barriers, help mitigate some of the hoops that folks have to jump through, and ultimately create a better community, create a better experience, and create a more thoughtful way of approaching this complex issue from multiple perspectives. The other thing it allows, I think, that should be encouraged, right, and foster in these collaborations, because you can't just say we're going to do this, right? The folks up here usually say we're going to do this, but the test of whether or not it's meaningful and fully developed collaboration and cross-sector engagement in whatever way is appropriate for your respective communities is whether or not the people on the ground who are actually tasked to do the work and talk to one another and do the warm handoffs and figure out how to coordinate and remove the barriers, whether or not they buy into it, right? And they've had an opportunity to weigh into all the great ideas that were talked about at the tables. And if they are able to actually execute it, right? And communicate and have a feedback loop so that we can continue to improve on the pieces that don't work or the nuances that weren't originally considered. And I think, that is what makes the collective impact model work. And again, in particular in this season where folks are losing access or having more difficulty with access because of HR1 right to healthcare and other resources, nutrition, et cetera. Resources are at risk for homelessness and housing supports. Like, I think really being thoughtful and having those deep relationships with organizations and leaders and other community providers and faith communities that you trust, and being able to be creative to figure out what do we have still, and being able to leverage that and really at least maximize the resources that we do have is one of the main benefits of this effort. And, the last thing I'll say is that even collaboration within your own sector is critically important, right? I know that sometimes I think, coordinated assessment and coordinated entry for the last, 13, 14 years has shifted the perspective to some extent, right? About competition within your sector, right? To working in a coordinated manner, and some of the funding policies and some of the realities that we're experiencing in the last couple of years have maybe started to shift that a little bit. And so not only, I think, do I want to encourage folks to build out connections and relationships with, law enforcement, right? We understand, I don't believe in criminalization of homelessness, but that there's a lot of opportunity when you connect with law enforcement in a thoughtful way to, again, save lives and possibly reduce the number of people that are being arrested because of the conditions associated with their homelessness, right? And even the faith community, right? I did a pilot where we worked with small Black churches in LA and parents who would put their children out because they were part of the LGBTQA plus community, right? And that's a taboo topic in the church, and we had some conversations, and the goal was, we don't want these youth on the street. We don't want all the consequences, right? And we brought folks together who have different philosophies, maybe different doctrines, maybe different beliefs, but we were able to work through it and try to figure out how do we stop these young people from ending up on the street and all of the other unfortunate things that occur as a result of that. And so those kind of collaborations are possible, even if you don't necessarily always agree with the approach. If the center is trying to help people and caring about the same population, then there's always an opportunity for you to align and to connect. And again, same thing, even in your own sector, connection across our own sector is critically important, more so now than ever. So I'll stop there. I have lots to say on this because I feel very passionate about it, but I'll pause there to give other panelists a chance to weigh in.
Yeah, I love that. I loved how you talked about having a shared vision or goal allows for you to remove egos and all that infighting. Sometimes that happens when we disagree on how do we get to the approach instead of like how, the end goal for everyone. So that's a great point, Veronica. Anybody else want to weigh in on that question?
I'll jump in real quick, Joshua. Just I'm deeply appreciative that we're talking about love. I lean toward that, and I know that it's a little bit of a wrestling match to figure out what we mean by that. But Veronica also said a bunch of brilliant things, but to test whether it's meaningful or not. And like, I think you have to go into these complex relationships. We in Central Florida here, we have multiple counties, multiple cities, all kinds of stakeholders. So you have to walk into a room, at least I'm learning. This is not something I'm perfect at, but presuming positive intent and having the assumption that people um, are trying to create meaning in their lives, right? Together, we're figuring out how to create meaning together. And that connects with love. I think for most of us, whether it's love for our families or our neighborhoods or our country or um, our neighbors. And so I think it's okay to step into that role a little bit. I think it's part of what keeps you sane and keeps you going. Um, but it can be difficult, right? I think we oftentimes are called to move into spaces where we're engaged. We say engaged with other egos, but like different points of view, different frameworks, different values. And I know I've gotten myself into trouble, just being somebody who's willing to talk to everybody uh, on all sides of the fence. And it can be tricky. And the only thing really that kind of keeps me centered at that point is like a belief that we're meaning making people, that we're people of care and love, and that we're trying to work that out uh, in as creative and humble ways that we possibly can. I think it's important that we talk about that, bring that to the center of what we do. So I'm grateful for the Alliance lifting that up.
Thank you. Those are really great points, Brian. Um, before, because I have a question that kind of builds off of that. I appreciate you flagging kind of like one leading with love, of course, but like, and then also assuming positive intent. That's so valuable because you really don't know the overall goals and like the what makes people tick, right? So assuming positive intent and then stepping into the belief that people that people that have care and they have being, they have value, right? Which sounds is crucial. So I'm gonna build off of that just to the question I have for you. How can leaders, in various sectors, prepare themselves and like also like close colleagues, close partners to really build trust specifically, right? And this, let's call out the elephant in the room during woefully polarized times, right? Like there's just so much conflict everywhere. How do we do that in this moment? With the understanding that the folks that we serve, they need it, right? So can you speak to like building trust in these moments?
I mean, I think it has to start with yourself. My mom used to say, worry about yourself. And so I think that's where it has to begin. I think that, we certainly have gone through a period of time over the last 30 years where there's multi-billion dollar energy or multi-billion dollar uh, um, you know, business behind trying to help people become better leaders. Um, and that hasn't always worked. I'm not sure that we're in as good of a place as I would like us to be in terms of leadership and building people of substance. But I do think there has to be kind of um, an inner work that has to happen in our lives, wherever that comes from, whether it's a faith pursuit, an intellectual pursuit, um, just a passionate pursuit of care and attention to yourself. Um, whether you're investing in great books, great podcasts, time alone, retreat, conference, whatever it takes for you, whatever your rhythm is, we've got to do that in order to be prepared to walk out in the world today. And I think people who are building meaning and hope and peace and stability in our communities recognize that in others. And there's just no way to maintain that without investing in your leadership journey and then investing in other people too. I mean, I think that's the opportunity that I love so much in kind of in a lead agency setting is I have a lot of um, colleagues that I'm able to speak words of encouragement and hope and grace into, hopefully. Um, uh, Opportunity to teach and to coach and mentor. I mean, I think these are kind of at the core of what we do is we invest in people, and I think that is the foundation that you have to build if you want to have trust in your community. That doesn't mean stuff's not going to hit the fan because it surely does. Um, and we get backed up against the wall, and sometimes we fall, we we step off a cliff, unbeknownst to ourselves. Unless we're making that kind of investment, um, we're gonna be a place of burnout. We're gonna be in a place of where we're gonna compromise our sense of self, our mission, our core values. And you know, I think a great exercise to start with that is if you have never sat down and tried to make a list of what my core values are, do that. You know, just sit down and spend some time thinking about what are the things that are non-negotiable to me, so that you know when you step in a room, you know, when you have meetings that get out of hand or you're in a tight situation with somebody you have a lot of disagreement with, you kind of just can sit in your own sense of self. It's really important.
Thank you so much, Brian. I took a lot from that. I mean, I think that my I think mother used to say the same thing. Worry about yourself. Start with yourself. I think that's powerful. And I think the intentionality around investing in your leadership, but also investing in those around you is really it sounds like you felt like it's a important tool to building trust. And then, you know, I think I've never done that. I think I need to sit down and list out my core values. So that going back to your first part is knowing yourself and starting with yourself. I think that's powerful. Does anybody else want to share anything about else around like how like kind of keys like techniques to building trust, specifically in these chaotic moments?
Yeah, some thoughts because I've had the opportunity to build just from scratch, but I've also had to build a whole community from a place of distrust and a lot of sensitivities because of something that occurred, right? And so I think just a couple of things for people to consider, right? Like when you are building or maintaining and trying to sustain these cross-sector collaborations or collaborations in general, like I think trying to practice radical transparency, right? And being very intentional about clearly communicating, going back to what I said around like what is the mutual goal and benefit, I think is a core part of it. And creating spaces for the group to co-create, right? To talk through, work through differences of opinions, but co-create the pathway forward. I think also, I one of the first collaborations where it was like the City of LA funded workforce centers in South LA, right? It was the State Department of Corrections, it was the city, and it was all these different perspectives trying to improve the experience for at the time people coming out of state prison that were on parole because our workforce centers and our Department of Labor funded workforce activities, especially for vulnerable populations, many of us know they're not necessarily meant to serve that population, right? So all these different perspectives, right? Bringing in psychology, and they started calling me like the spreadsheet queen because seemingly some very textbook things, but like clarity is what I'm trying to get to. Having clarity in terms of what are the roles, what are the overlaps of the roles, like being very clear to try to minimize confusion, not at the only at the table where the conversations and decisions are being made, but again for the people on the ground who ultimately have to execute whatever the collaborative roles and responsibilities are is critically important. So just being intentional, I want to say, right? Like I think that informality and rapport building and just those relationships are critically important. But there's also some of the structural pieces. A lot of collaborations, they don't take time to do that. And I think that's where some of the confusion or the breakdown or the stalls of things that could be moving forward happen. And so just being very thoughtful and intentional and radically transparent and making sure clarity is at the center and that folks are on the same page before you keep moving to the next phases will build trust. And obviously doing what you said you're gonna do, right? This is a little bit of an add-on to what Brian said, but doing what you said you're gonna do and being authentic and being sincere and honest, even if you're having to deliver difficult messages about things that may have shifted within your organization, being honest and authentic builds trust.
That made me think of one more thing, Veronica, and this is really a Brian 2.0 kind of thing because I definitely not like this. I've always been somebody who's been somewhat unimpressed by title and walking in a room if someone expects accolade or they have a certain status within the room. I've always somewhat retreated from that, but as a leader who's trying to build trust, I need to find ways to appreciate people genuinely. And if I can do that, even if it's even when I experience a resistance, whatever that resistance is, because they have a certain title or because they are they possess a certain point of view or what have you, I can still walk in the room. It doesn't cost me anything to appreciate them for something about themselves. And I'm not talking about something that's inauthentic. I'm not talking about being fake. I'm not talking about glad handing. I'm like, again, is make the assumption that the person that you're with is somebody of meaning and purpose and dignity. They have a different point of view. They're coming at it from a different direction. But if you can find a way to have an appreciative approach towards them, even if not verbalizing that, you're going to find you're going to be much more successful at winning them over, or having the opportunity to offer your point of view and to build trust along the way.
Well said, Brian and Veronica. So we kind of talked about like how do we build those relationships. We talked about like the collective impact, setting shared goals while we're building this coalition or collaboration efforts. I would love to. I'm going to pivot a little bit to you, Demetrius, because you spent a lot of your professional life and your expertise in the law enforcement world, and now working with law enforcement agencies to really reduce harm and work better with homeless response systems. I'm just going to ask like the bigger question that I know you're going to really dive into of like, what are the consequences of the homeless response system not having relationships with law enforcement? And like, what are some things that you've seen can help bridge and build a better partnership to really reduce harm, as we've been saying, and really help to connect folks to services that actually address their crisis?
Well, first of all, I just want to start off by saying that there's a lot of good points being made here. You pointed out when you started off with the slides that there's a lot of redundancy. There's everyone sitting in their silos. Brian's pointing out that we need authenticity and to have genuine conversations about where people stand and their perspectives. And Veronica, I appreciate very much the fact that you said egos are in the room and they have to be accounted for. All of these things are complex social interactions, right? We're not prepared for them. We're not given the opportunity for training, any formal training on how to build relationships. We're very good at making partnerships and having lots of meetings and contacts, but we often find that they're not fruitful because we don't know people's accountabilities. We don't know their limitations under the law or their policy. And it's hard to hold people accountable, especially from other agencies. And I can speak directly to that. It's probably most hard, or the hardest to hold a law enforcement agency accountable for what's happening in the community when they're not part of a collaborative effort for such an important issue as homelessness. So when we started doing this work, my partner, Molly Mastores, is a licensed professional counselor, comes from the world. And this is common for most of the folks probably on this webinar, but I can tell you it's not common for people from the law enforcement or public safety world. We are not taught how, the same way in social work and in mental health, how to build relationships. We're not given any of the techniques and skills that are required for helping a person experiencing homelessness or dealing with community service providers or faith-based leaders. We are just we can feel this burden of having to just respond at 2 in the morning when there's no other services and we're not equipped to deal with those things, right? What we have found is, and what I found being a patrol cop for many years in the DC metro area, until I needed to build relationships with people who I needed more than they needed me. Because when you start focusing on prevention, you need everyone to come to the table. You need capacity for work, and you have to focus on what the problems are. And you're not going to do that without everyone's expertise. And until you understand the role of empathy, until you understand and can walk in someone else's shoes to hear their perspectives, to understand what those barriers are to working with you, nothing's ever going to get done, especially from our perspective. We just show up, we have a uniform on, we just expect everyone to listen to what we have to say. And that's just not the way it works. It's not the way it works, and it's not productive. In creating, this model, this proactive alliance model that we use with Safe Night, it's the foundation for all of our work. It's worked for, like I said, prevention in downtown and nightlife. It was the original model for the Homeless Outreach Coalition in Arlington County with the work of Mike Keene. This is the model that we brought to Wichita, Kansas. And we're doing this work now with the COCs here in the state of Connecticut, where we are based out of. No one's, we don't come from the perspective is that, we're going to teach anyone doing this work how to do their work in a better way. They're the experts of their community. They're the experts in their field. But what we find is that they are siloed. If they're siloed in the office, they're just bringing their silos to the street. And what we find is that there's not a unified strategy because, again, we don't know how to support. And when I say we, I mean most people in law enforcement don't know how to support the complex work of housing, community service providers, faith-based, the shelters. We don't understand what a person-centered approach is, right? When we look at person-centered approaches, that's usually from a criminal perspective, as opposed to a prevention-based perspective where we are supporting the work of social services to keep people moving forward rather than disrupting or causing harm to folks who are in the pipeline. And that's really what, if you're going to have a takeaway here is don't just assume that law enforcement knows what to do in your community. This is the start where you can begin having a conversation, like Brian said, invite them to the table, find out what types of training. Crisis intervention training is a great start, but it's not, that's not the foundation for building relationships in the moment of crisis. That's for the moment of crisis. We're talking about the prevention work farther up the river here. So when we talk about prevention-based work, we're talking about before and after crisis, but you have to understand what's going on in your community. You have to understand the players. You have to understand all the work that's being done, and that's not something we are accustomed to. The other side of this is, and I'll point this out real quickly, is that homeless outreach teams exist all over the country that are law enforcement based. However, there is no formal homeless outreach model for response. You find agencies just reach out to other agencies and say, hey, what are you doing? What are your standard operating procedures, or what are your general orders? They never receive any formal training. They never have a real understanding of what's needed from them. So again, the whole point is to professionalize this work, to create a national model so that agencies can use this as a foundation and then adapt it for the needs of their community. Research that came out from Indiana University just a couple years ago, and more recently with the National Policing Institute, it tells us that there is no formal model, but that police need to be in this support role, but they need to understand how to support all the work that's being done by, from the COC down. So that's the perspective we come from. Again, we use this same process, I like that Kevin said in the beginning, he doesn't want to separate evidence-based and faith-based, and I agree with that. But most police agencies don't really understand the definition of evidence-based. We call evidence-based pretty much everything these days, and what the need for empirical evidence is, so that we can understand why something worked and then replicate it to have those same benefits and outcomes. So that's my perspective. I'm happy to, as we continue to talk, but I appreciate everyone I think we're all on the same page here, and there's a role for everyone, including law enforcement in this work.
It's really interesting that it's just within the last like 3 or 4 years that we've seen so many more law enforcement agencies kind of tiptoe their way into the homeless response community. We have a large conference in Florida that we put on every year. There's still space available if you want to come. But more and more law enforcement showing up, and it's fascinating how passionate some of these law enforcement officers are. And it's like they find a new sense of themselves. They reconnect to the reasons why they got into law enforcement in the first place, which was to serve others. And I love those conversations. And yet there's a lot of difference. It's just like the it's just like any other sector that you move into, is that you have people coming at it from a lot of different perspectives. And it really has been important for me to step back and not make assumptions about how this officer or that officer is going to approach it, because there's just a variety of different entry points.
I was gonna say from the service provider perspective, because that's where my day job has always been. Um, I'm sure I'm not alone in having the experience that there you develop relationships with certain officers rather than departments, right? And that you sort of hope that when you make the call that you get one, or in some cases you don't get a certain one. Um, I think there's just an opportunity to uplift um, when there are those relationships that exist and provide direct lines. When I was in LA, there were particular officers that were assigned to homelessness response and who actually came to spa coordination meetings. And I think that's just so important, not only to create those partnerships, but also to identify the folks who have a natural inclination toward that type of partnership within the force, and to be able to give service providers the like possibly a direct line. We in LA, we recommended like a bat signal that we could throw up that only one police officer would see and respond to when we had an incident, right? Obviously, that's the silly version, but some sort of partnership that elevates that there is good work being done, even for those service providers like myself, honestly, who our relationship to law enforcement right now is, if we have to call them, it's because it's our absolute last option. We've exercised everything else before that, but we would still prefer specific responses, and often that boils down to specific relationships that we've built over time.
Kevin, that can't be said enough. And the other side of that is we depend on the agency to educate or require or ask other partners to come in and educate our officers, when it should be the officers who are doing the work, who are most knowledgeable about the systems that are happening every day in the work that you're talking about. And we developed a peer-to-peer model. Essentially, you have to do enough work with not only the rest of the officers, but as well as your command staff. We have a high rate of turnover within public safety. We have new promotions and new retirements, and people have transfers of assignment. And we know that those relationships that you built with an officer for 3 years who was operating at a very high level, they can be gone tomorrow. So we can't have an absence of expertise and knowledge just be absolutely gone. So officers need to understand how to support this work, essentially do enough not to hurt the mission of what everyone's working on. And then when new bosses are promoted, that they don't come in here and say, we're going back to an enforcement only approach, and ruin all the trust that's been built up with all the providers as well as the clients. It is starting from scratch again, or clearing encampments when we were that close to getting somebody housed because they lost all their documents. I can't think of anything more frustrating.
No, I loved all that, Demetrius. I think, and to your point, Kevin, there's like the institutional or like provider level relationships that happen with law enforcement, and then there's also like how do you have those deep institutional relationships that aren't as fragile as like a case manager leaves or the go-to, you know, a police officer who in the community leaves, right? That's really built on continual trust working towards the same direction. And then also, I think there has to be those honest conversations within those conversations around like the historical trauma and like there's some things that's happened that you can't necessarily act like didn't happen, right? But do it in a way that is focused on a common goal. To Veronica, your point early on around like how do we work towards a goal, even though I don't fundamentally agree with every approach historically you've undertaken, but the goal is to how do we not ensure that the folks that we're serving are fined and jailed, and when they're close, we're working towards getting them into housing. So I love framing that.
Yeah, it feels like, you know, one of the really critical parts of our interaction, like the LEAD program. Many people are familiar with LEAD because it's across the country, right? We did that. We're the first to do it in Compton, right? And we've had lots of other collaborations, but it was very interesting to share perspectives, to your point, Demetrius, but also for our team to better understand like a lot of the constraints and a lot of the guiding principles and protocols that officers have no choice but to follow, right? And understanding that. But the other thing, we bring up the trauma, Josh, just like many other folks across the community, many of the people that work in our agencies have lived experience in some shape, form, or fashion, or have had negative experiences with law enforcement. So it wasn't even only about talking about how to maybe have a different approach, right, collaboratively, but we even had to do some rapport building and get our own outreach team members in particular, right, and other folks that have to be connected to law enforcement to be comfortable enough to be in the space with them, to be comfortable enough to be in regular communication with them. And we achieved that, right? But I just want to, there's so many nuances, and that's what we talk about being really honest and thoughtful and intentional. And we got through it, and you know, some of the best relationships are between some of those same folks who were just traumatized by seeing somebody walk into the meeting space with a uniform on. But all those things only come if there is a willingness to show up and really center again what the intention is, and or what the shared goal is, and to be honest about some of the barriers and work through them together.
And it takes time, Veronica, like a lot of time, and you have to be really patient. And I'm really glad Demetrius is here on the scene now. It's going to help us all pull things together. But the leader, whoever's leading has got to have a commitment to time, right? To be okay with some setbacks, right? When we first started pulling together law enforcement in our community, and there was a lot of skepticism that law enforcement wasn't sure they wanted to talk to us. But we kept showing up together. And then we had times where law enforcement were going at one another, right? One law enforcement agency was not happy with the other law enforcement agency, but you have to hold the space. You got to create the container. And you talk about building trust and that kind of thing. It's like that takes a lot of time. It takes a lot of relationship building. It's important for whoever's facilitating that space to be committed to the idea that holding the space is as important as getting something accomplished in any given minute. That purposely dedicating yourself to creating a space where trust can be built, where hard things can be said, where we can make mistakes and say things that we maybe shouldn't have said, and something, you know, can be okay to say ouch, right? But that's really important. It takes a lot of time. We're not where we want to be with our law enforcement relationships, but we're excited that kind of cross-sectoral partnership that's happening, and law enforcement is used to that. I mean, law enforcement does this cross-sectoral stuff all the time, and in some ways, law enforcement is more easy to access than the health sector. The health sector is so heavily institutionalized, and it's very different. But with law enforcement, you can actually connect with officers. They're out there doing the work, and so I think I'm super excited. I don't, that's maybe pushing it beyond, but like we're in the moment of criminalization, right? Like there's some really bad stuff that's happening, and it's not law enforcement. It's typically law enforcement doesn't want to do it. Most folks that I talk to, but there is some emerging opportunities for us in building alliances with our law enforcement partners.
Yeah. Thank you for flagging that, Brian. I think so. Again, Demetrius, I love the presentation, and I think the goal of our conversation today is really to look at and invest in what partnerships can we continue to build, and law enforcement is definitely one of those. You kind of mentioned healthcare. I think Veronica, you might have mentioned a little bit of behavioral health and kind of some of the work you were doing early on, like really needing to build those partnerships out from the leadership lens, so they could be really baked into our approaches and how we move forward accordingly. So one of the ones that we haven't talked to specifically yet, and I'm going towards you, Kevin, is really the relationship between the faith-based organizations and the homeless response system. One, I think there's kind of some misconceptions around like faith-based being involved in the homeless response system, as most communities that's who usually does a lot of the work. But how can we do that and bring maybe more of the partners who aren't at the table and into the work, to really ensure that we're all working collectively and collaboratively to use our resources, services, and capacity to really help bringing people home, and also wrapping them up around the supportive services and the community integration that's needed to help folks thrive.
Yeah. I love the question, and I'm so grateful to be here. I mean, first off, I would just say take everything that these other folks have said and just apply it to this topic, right? We're talking about complex relationships that we have and that we need to have. I think one of the biggest misconceptions of our sector, whether that's at the service provider level or the COC level, is that we don't have a relationship with faith-based providers, right? And if nothing else, we have a relationship because the people that we serve have a relationship with those providers, right? We're serving the same people. Are the folks who come to our COC drop-in centers, our shelters, are staying in our PSHs, also go to the Wednesday night meal at the Baptist church, right? They go to the food pantry at the Methodist church. They go to whatever it is at the Temple Israel, right? We have a relationship. We're just either ignoring or we are blocking that relationship from becoming something else and something that it maybe needs to be. You mentioned the misconceptions and the misperceptions, right? I think there's a couple of them that really stand out to me. One of them is that some have the perception that faith-based organizations have been shut out from government funding. That's actually a perception that HUD is pushing right now in this sort of reversal to say we are now going to bring back faith providers into the mix when actually faith-based providers have been receiving HUD funding for a long time. Now, the ones who don't are for particular reasons, right? It may be a technical assistance reason. It might be hard for the small Presbyterian church to figure out how to apply for a HUD COC grant, right? Other reasons are that particular churches want to be able to discriminate in the ways that they want to discriminate. We need to be honest about that. And that's why they haven't been eligible for funding. That they're committed to a treatment first approach rather than a housing first approach. And HUD has said that we want to fund housing first approaches, right? But this notion that just being faith-based alone has meant that you can't get HUD funding is not true, has not been true. I think another perception, kind of on the other side, is that all faith-based providers are anti-housing first, anti-harm reduction, and have totally different values than the rest of us. My experience over and over again has said that that's not true. The truth is that, yes, there are some that are very vocally anti-housing first, anti-harm reduction, who want to discriminate. But there are others that are full tilt housing first and harm reduction. who are absolute amazing allies in this work, who don't discriminate, who are fully affirming of LGBTQIA plus identities and relationships. Uh, and so those can both be true at the same time. Uh, I would add too that most faith-based providers, whether they're nonprofits or just churches who offer some sort of services, are actually somewhere in the middle, right? A lot of them don't even necessarily know that there's this big ideological, philosophical conversation happening. They're just doing what they do, right? And so, how we approach those three different categories of churches or faith-based providers will be different, right? How we do reach out to the historic rescue mission that's made it very clear that they want to drug test everybody and that everybody has to achieve sobriety and this, that, and the other before we move them along to a transitional housing program. We may have to partner with them at arm's length, right? That may be a little bit more like how my organization currently partners with law enforcement, where we're only reaching out if it's the absolute last resort, right? Somebody needs a bed tonight and the only one available is at the rescue mission, and the person has said, I'm okay with that. Please refer me anyway, right? Um, but there's all sorts of other partnerships that we can make with those who, one, are full allies of our values, that we can share those values with them being faith-based, and we can develop really rich partnerships. But the ones in the middle, those to me are the biggest opportunities, right? Those churches, those faith-based partners that say you may hear some things from them that sound values aligned and some that don't so much. Those are partnerships for mutual education, right? For bringing folks along. I think we don't do nearly enough in this field for narrative work, narrative justice, and recognizing that um, we have opportunities to teach people the things that we've learned, and that we didn't all enter this field knowing all of our values, right? We all learned them along the way. Someone took the time to teach them to us. When I first started in this field, I was very skeptical of harm reduction, right? And over time, people poured into me. And I learned a lot from direct proximity to people who experience homelessness and harm, right? So, uh, ultimately, I think a first step, right, is understanding the lay of the land without making assumptions, seeing who are the faith-based providers, who are the churches that they volunteer, they show up, and figuring out, are these folks who have a totally different set of values than us? Do they have the same set of values, or are they somewhere in between? Um, be clear-minded about your values, right, and what your boundaries are, but then see what types of relationships are still possible within that. Again, these are complex relationships. It doesn't mean that because you're willing to take a volunteer group from the Southern Baptist Church that you embrace all their values, right? You can have meaningful partnerships, as Veronica really said so well at the beginning, right? We don't have to be in 100% alignment to have some kind of partnership, but the boundaries and the values of that partnership are going to be different depending on the partner. And really, I think we have to recognize the vast potential of having good relationships with faith-based organizations and what they can add to a continuum. They have, I mean, talk about housing. They have land, right? There's been a huge movement lately to build on church-owned land, right? That's been a huge, huge movement that we need. Land is the most expensive part of housing development, right? Um, Churches can show up and advocate when you're trying to build a new building, when you want to put up PSH and you need a passionate group of people to show up in matching t-shirts to the zoning commission, right? That's a church group, right? If you can get them on board, they'll show up. Volunteers, of course, we've said it. But I also think that the faith-based folks have a lot to offer in terms of spiritual care. I think we underestimate how much folks who experience homelessness do want and value spiritual care. Now, I would differentiate that from, preaching or proselytizing, right? But somebody who can say, like, I do you want me to pray with you, right? And who will take no for an answer, right? Or who can have these conversations and these deep reflections on meaning and purpose and belonging. Um, And these are the types of things that when we get very focused, as we have to, on housing outcomes, that we miss out on. That I think we have some things we can learn from faith-based providers who offer a level of care that sometimes eludes us as secular or government entities.
I got so much to say about that, Kevin.
I know you do, Brian.
I feel like, you know, any of us who spend our careers working in this, doing this work, know it's a journey. And things have, there's been an arc of change. Norm Sukar spoke at the NAEH conference. He kind of took us on like a historical tour of homeless services from the 80s to the 90s to 2000s. And who would have said, any of us back in the 90s, that in 2026 we would have data systems that would connect all of our services, and that we would be in charge of keeping people's personal information, and that we would have these things called COCs. It would be hubs in a community, and they would be working and planning together in order to talk about all the people working to end homelessness. Like, we have gone from like individual churches back in the day feeding people soup and a day old donut, to complex systemic partnerships, right? And we just got to be real about that, you know, like it's a system, and we can't be like too high. Those of us who work in the system now shouldn't be so high and mighty. Systems suck. I mean, who's gone to the hospital and thought, wow, that just really worked well for me? Or who's like gone to buy a car and thought, wow, this car buying system is really top notch. Can I do it again? You know, like nobody wants to do that. And so we all have a responsibility to be honest. Like, I was caught in a conversation this last week where I felt like I was pulled into those ideological battles between housing first and treatment first or whatever. People that said we got to teach people not to become homeless anymore, and how we're all about transforming lives. And on the other hand, people talk all about housing first. Like, okay, can we just admit we need both? We really need both. We need services and housing. We can't do one without the other. And we need human-centered, faith-inspired, love-connected movements of people that are working to serve people who don't have a place to lay their head tonight. And that's all about faith. I mean, the Bible that I read said that we're supposed to, you know, build houses and plant gardens and marry off our sons and daughters and seek the peace of the city. And that if we did that, we find our own peace. And so, you know, like we get into these battles, and it's just us humans trying to, like Veronica said, save lives, right? Like, we got, like, here we are in the most prosperous society the world has ever known. And we're trying to figure out how to give people a place to lay their head without having to worry about getting arrested for being on somebody else's property or you know, whatever. So I mean, I think just like we take this we're very deeply ingrained in systems now. And then but when we come together and do this work, you know, that's why I love this, that Alliance is pulling out love, you know, it just, and even if we don't know what it is, it just mixes us up because it calls us to a kind of human engagement that opens up possibilities and curiosity so that we can work with law enforcement, we can work with healthcare, and we can work with behavioral health. And we need all of these people together in order to make the change necessary to make sure that people aren't dying on the streets.
Yeah, I really appreciate that, and your passion, your clear passion about it, Brian and Kevin. Your remarks were really thoughtful, and I think I really appreciate the nuances that you brought up, and I you know, click everything that you said because I agree, and Brian, everything that you said as well, and I think that, you know, coming back to the beginning, if we center all of these potential collaborations and connections that we're considering in the people who we're trying to help, right? Knowing that there'll be ideological differences, as long as it's not an organization that's literally causing harm, right? And a completely doing so, then I think that we can do anything. And I think that, I always talk about, and I've in particular been saying this to a lot of system leaders, like, I know that, you know, your world is COC or the contractor providers, right? And that's what you really focus on. But there's a whole ecosystem of other folks who are on the ground doing the work. And a large part of that network are our faith-based communities. And they are truly an unrecognized in some communities safety net. When the public dollars run out, when the slots are full, when you add whatever is relevant to your community, our faith communities are stepping up still, right? They're piecemealing, they're figuring it out, they're doing all kinds of things. And whether it's directly related to housing or feeding people or nurturing people's spirit or encouraging people or providing clothes or whatever the activity or activities are to just center the humanity of people, they're doing it. And I think that um, it's really important for those folks that are those of us who are so system focused, whether as a service provider, a COC, a local government, some other kind of funding administrator, to really recognize the collective impact model goes well beyond those federal, state, and local dollars. And if we start to shift the lens to understand that and acknowledge that and try to understand fully what's available for the folks that we're serving. And I love that, Kevin, when you said the commonality is the people that we're all helping. You said it a little bit differently, but that was really poignant. If we start to broaden our perspective and thoughtfully figure out how we can make sure we minimize and reduce barriers for folks to access all of the care, love, support, services, housing, et cetera, that's available for them, then that's when cross-sector collaboration really begins to do what it's supposed to do. That is really where collective impact comes in. And so just want to encourage everybody here, many people know about the great work, but think about how to include them in your ecosystem. And in some communities, some of the efforts can be funded, right? And as Kevin said, there's a lot of federal dollars that have gone, but a lot of it is unfunded work, but they're still doing it as outreach ministries, as other things. And I think just considering them as a part of the network, I'm going to use the term network instead of system, I think will shift a lot of the challenges, or that's them over there, that's us over here, because we're all serving the same folks. The only other thing I would say is that I think that, I have been really integral to a lot of the harm reduction work in LA County, right? And even across the state, and really proud that the fatalities from overdoses for people experiencing homelessness for 3 years in a row have gone down. And I know it's a direct result of the work that we've done. Have also led substance use programs and recovery bridge housing that was abstinence model and everything in between. And so I think that there's not one size fits all. We all know that. And I think that people themselves are interested in a variety of supports. And I think that if we can, educate, to Kevin's point, folks, but also just recognize that our network has to include a menu of options. It can't just be one thing, right? Certainly housing first, I support. I always say, Josh knows this, housing first is not housing only, right? You've heard me say that I don't know how many times, but there has to be a menu of options because people's journeys that led them to being in a housing crisis, being unhoused, being homeless are varied. And the supports it's going to take to get them to wherever they want to be are varied. And so I think that the faith community in particular is sometimes villainized for a variety of reasons. I told you all about the bridge program I came up with. People thought I was crazy. I was like, let's try it, right? Talk about this taboo topic, try to figure out. But I think that as long as we are recognizing that people we all say one size fits all, but do our approaches as organization, as systems, in terms of who we partner with really reflect that? And that's the question we have to ask ourselves. And if not, let's step back a little bit and really think about who's all trying to help the same people we're trying to help, even if their approach to it is a little bit differently, and make sure that that's our approach in terms of how we determine how to partner and align ourselves with other folks. But I really appreciated Kevin and Brian, your comments, and I really agree with everything you said, and I really love how you articulated it.
Yeah, I think it's really important to just keep saying that you can be so clear-eyed about your own values and not compromise them and still have relationships with others that have differing values. And we have to. We just have to. And I think sometimes um we intentionally we sabotage those relationships out of our own standing, right? I had a conversation with someone recently about, we were working with a young person and their landlord was just being like absolutely horrendous, right? And there was a part of us that wanted to stand on business, right? And tell that landlord what was what. And that's easy for us to do, but it would harm ultimately the young person, right? That's who would get the brunt. And I think that's sometimes how we approach these partnerships. Like, I refuse to have a partnership with them because they don't fully embrace our values, and that makes me look good, right? Because I'm standing up for my values and refusing to compromise. But ultimately, who ends up missing out on the potential of that partnership is the people who we're mutually serving, right? Sometimes we need to. You mentioned it at the very beginning, Veronica. That's ego more than it is values, right? You can be so clear-eyed about your values and still have relationships with people you disagree with. And we do it not for our own sake, but for the sake of the mission.
And I'll just add to that. I mean, I think while we're arguing about which approach works, neither approach is funded to do the work it's supposed to do
Right.
anyway. And so I think there's the issue of like, we can talk about all the approaches. Like, can we have funding to do something at a school scale to actually meet the needs of the problem? And I think that's kind of where I think building those coalitions and those conversations and we can work together collectively to actually work towards a common goal. First realizing like, hey, we all get shortchanged in this whole conversation. So I wanted to just pivot really quick. So I think this is a really great conversation. This is kind of building off that a little bit, Kevin. This is one of the questions we got earlier on, but I've been holding on to it till we got towards the end of our conversation. And I think so. We all talked about like how to build these relationships and like the process. When and if ever is it? When do you? How do you navigate moments where you're building with the institution and they're maybe not acting in good faith? They're presenting maybe they're doing harmful practices or and even maybe mischaracterizing engagements or sending out misleading information. How do you navigate the negative part of coalition building? And as we're building this table or this ship to get people where they need to go.
Was that to someone?
Man. Oh, sorry. Was that for Kevin?
I wasn't sure, but please.
Sorry, it was for the panel. I apologize. To the panel, whoever wants to jump
I was going to say something really short. You got to keep on chopping. You got to keep on chopping. You just can't stop. You got to keep going back at it. So much disappointment and frustration there, and some real danger, right? Like, I think some of us have experienced real reputational and potentially career harm as a result of agendas and people misinterpreting. And those are all real. But you got to keep showing up. And I think, again, for me, that's why at least the kind of second half of my career has been so focused on how do I develop my inner core, my inner strength to withstand some of this, just because I'm finding myself in spaces where the stakes are so much higher than they were when I was a younger man, and so I don't know how I figured it out. That I'm figuring it out, but I think that we owe it to one another, as people of care, as people who are trying to create a more just society, a more loving and caring society, to keep showing up, to keep waking up, whatever that reason is, for your kids, for your city, for a sense of justice and peace. You just got to keep chopping.
Yeah. So we were talking about the importance of it, right? So I didn't really spend a lot of time in terms of how I assess whether or not it accomplishes all the things that I said they're meant to accomplish. And so obviously again the common goal and all those things are important. But when I talked about authenticity earlier, I talked about that because that's how I show up in spaces. But for me, I'm looking at what your motivation is, right? And so if your motivation, if you're driven by something different, um, I'm gonna not partner with you, or I'm going, if I assess that it's harmful to what we're trying to accomplish, I'm going to have the conversations. And if we are just misaligned, then we'll end that partnership. If you are um trying to if you are driven, I lost my train of thought, but essentially if you are trying to um if you are doing things that are harmful to folks that we're serving, and we discover it, we talk through it and understand that it's not a misunderstanding, you know what I mean? It's not unintentional, but you actively are practicing things that are harmful to the folks that we're trying to serve or harmful to the employees that are a part of the collaborative. Um, then we have conversations, Josh, and we get out of it. I think that, what Kevin said about being very clear about what your values are, who you are, and then even prior to that, Brian talked about personal core values, but really, what is your organizational culture? What are your values? Where you're not going to make concessions, right? That has to sit at the center as to how you determine whether or not you enter into new collaborative efforts or that you stay in them, which is why I said you have to be intentional about meaningful tracking, right? And assessing whether or not it's still doing what you want to do. But if you are centered in what your organization believes in, then if it doesn't work for you anymore, if it doesn't meet the needs of the people, or if it's just harmful, not necessarily well, to your brand as well, but if it's harmful in terms of what you're trying to accomplish, this is what I was going to say. Integrity is core, right? For me, and I think for many of us. If I discover that even though we're somewhat mission aligned, but you cross integrity lines that we wouldn't cross, I wouldn't cross, I'm not going to work with you, right? Because I have a very hard line. So I think just having as an organization, as a system leader, clarity about what you will and will not compromise on, even if it's a really fruitful conversations. I've had to, conclude some collaborations that were really meaningful, but with those three things I just said, if one of those things occur, we can't work with you anymore. Um, so yeah, I think having a clear plan of action as to how you make those decisions as an organization, as a leader, as a person, is critical as well. Maybe that's the next series, Josh.
Yeah, Josh, I'll add one more thing. I think people need some foundational work so they can legitimize their perspectives and their contributions. And instead of, we get derailed by how people feel about things and what their identities are, what they should do, rather than what works. And when, we understand the accountabilities, when we understand the limitations under law, Veronica talked about this earlier. Sometimes the conflict is, I just didn't know you weren't allowed to do that, or there's a policy or law that restricts some sort of action or requires you to act. So it's not personal, but if you understand what the accountabilities and limitations are of agencies, it's easier to not take those things personally, right? So we can understand how to work as an agency. There also needs to be some succession plans so that we have what Brian talked about, consistency. We need some consistency across the disciplines, right? We can't keep coming into these very complex problems with reinventing the wheel every couple of years. And that's the law enforcement is probably the biggest offender of this of any, because, like I said, of the turnover. So at this point, I think, if we're going to do something different, it's let's look towards foundational models. Let's look towards empirical evidence as to why we're doing things or not doing things, or what should we be changing, and then bring everybody to the table. It's the having not just a place at the table, but understanding your capacity, your expertise, in service of the problem. It's one thing to have an opinion. It's another thing to have expertise and knowledge that can actually help.
Yes, thank you so much, Demetrius. And as I asked the question, I heard with the great responses that you all shared. We actually have been leaning on a framework in a book by Loretta Ross called "Calling In." I would encourage you all to check it out if you haven't had the chance to. But it really breaks down like coalition building and building authentic relationships, and has different. When do you call out, like, right, like publicly kind of embarrassed? When do you call in, right? Like, hey, help me understand. You said this, and can you help me explain how that happens? That's more of a private relationship. When do you call out, right? Like, this is harmful to my staff, harmful to people we serve. And then when you call on, right? Like encouraging folks to do more. So I think there's some, and that you're using your discernment, your relationship. One of the things she talked to us about calling in is because when you call out, sometimes you'll be calling somebody out and ruining a relationship for maybe a 10% of a problem that you all don't agree on, when you agree on 90% of everything else, right? When do you call in people to correct their behaviors versus just quickly calling out? So that's just one thing I wanted to frame. I wanted to highlight really quick some of the takeaways that I think I heard from our call today. And one, thank you to our phenomenal panelists. It's where we can easily fill another hour. But I'm going to share just my screen really quick. So just some of the key takeaways, and I didn't capture everything, but like really starting with yourself and really interrogating your own stuff, but prior to moving forward, investing in people, invest through leadership, through folks in your community, folks in your system or your coalitions. Center the people we serve in our approaches versus ideologies, right? Stay focused on the main goal as you're working collectively. Lead with curiosity, right? Ask questions and lead with that authenticity that's highlighted so much, and that transparency that was also highlighted. Really understand the landscape, what's happening, and approach it with that humble curiosity that I just mentioned. Honor the process, right? Honor the relationship building, the work that goes into actually building towards something, not only just the desired outcome. Build the relationships intentionally, trust and meaning, to have those really entrenched, trustful, and meaningful relationships, because that's what's needed in order for something to really last as we can continue this work. One other thing I was going to mention is just we have our next call is from crisis to housing, improving system flow and expanding housing pathways. That's going to be Tuesday, August 25th. I can't believe we're already close to August. And with that being said, just thank you for joining us. I know there's 1,000 different things you can be doing. We have a phenomenal panel, as you saw. Thank you so much for your time. Reach out to us with any questions. With that being said, thank you. And thank you to our phenomenal panel. This is such a great conversation. Have a great rest of your day.
Thank you.